Good evening. This is All India Radio. I am Saira Mujtaba and with me is Vaibhav Jyotsna Srivastava with the evening news. The headlines. CBSE 12th board examinations cancelled. Prime Minister Narendra Modi says decision on exams has been taken in the interest of students. India registers significant decline in active caseload and number of fresh cases. Recovery rate improves to 92.09%. More than 21 crore 60 lakh vaccine doses administered in the country so far. Defence Research and Development Organization issues directions for use of 2DG medicine. Centre introduces new system for processing of insurance claims under Pradhan Mantri Garib Kalyan Package Insurance Scheme for health workers fighting COVID-19. External Affairs Minister Dr. S. Jaishankar says collective endeavour of BRICS is to ensure that global decision-making reflects contemporary realities. Mahesh Jethmalani and Swapan Das Gupta nominated to Rajya Sabha. And in tennis, world number 1 Ashley Barty cruises into next round of French Open. Naomi Osaka pulls out of tournament amid row over media briefing. In the wake of COVID-19, we appeal to our listeners not to lower their guard and stay safe and protected by following these 4 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene, and get vaccinated. For providing COVID-related information and guidance to the people, national helpline numbers 011 239 78046 and 1075 are operational. And now the news in detail. The Union Government has decided to cancel the CBSE Class 12 board examinations. It has been decided that Class 12 board exams would not be held this year. It was also decided that CBSE will take steps to compile the results of Class 12 students as per a well-defined objective criteria in a time-bound manner. It was also decided that in case some student desires to take the exam like last year, such an option would be provided to them by CBSE as and when the situation becomes conducive. The decision was taken at a high-level meeting chaired by Prime Minister Narendra Modi today. The Prime Minister said the decision on Class 12 CBSE exams was taken in the interest of students. He said that COVID-19 has affected the academic calendar and the issue of board exams had been causing immense anxiety among students, parents and teachers, which must be put to an end. The Prime Minister said that the COVID situation is a dynamic situation across the country. He said while the numbers are coming down in the country and some states are managing the situation through effective micro-containment measures, some states have still opted for a lockdown. He said students, parents and teachers are naturally worried about the health of the students in such a situation. The Prime Minister said students should not be forced to appear for exams in such a stressful situation. The Prime Minister emphasized that the health and safety of students is of utmost importance and there would be no compromise on this aspect. He said such exams cannot be the reason to put the youth at risk. The Prime Minister said that all stakeholders need to show sensitivity towards the students. He directed officials to ensure that the results are prepared in accordance with well-defined criteria in a fair and time-bound manner. Referring to the wide consultative process, the Prime Minister expressed appreciation that a student-friendly decision has been reached after consulting all stakeholders. He also thanked the states for providing feedback on this issue. The Prime Minister had earlier held a high-level meeting on the 21st of May last month. Defence Minister Rajnath Singh, Home Minister Amit Shah, Finance Minister Nirmala Sitharaman, Information and Broadcasting Minister Prakash Javadekar, Women and Child Development Minister Smriti Irani attended the meeting. In addition to the Union Ministers, Principal Secretary to the Prime Minister, Cabinet Secretary, Secretary Higher Education and School Education and several other senior officials of the Education Ministry, CBSE Chairperson were also present in the meeting. Earlier, the government had decided to cancel CBSE Class 10 CBSE board examination in light of the second surge of COVID pandemic this year.
The Union Government has said that India is registering a significant decline in active caseload and the number of fresh cases. With this, the recovery rate is continuously improving in the country and it has risen to over 92% in the country. Briefing the media in New Delhi today, Joint Secretary of Health and Family Welfare Ministry, Love Agrawal, said that the country was registering over 3 lakh cases a few weeks before, and today India has registered above 1,27,000 cases. He said the country has registered almost a 69% decline in cases since the highest reported peak was recorded on the 7th of May. Mr. Agrawal said the continuous decline in active cases has been witnessed in the country. He said almost 50% reduction in active cases has been recorded in the country within a span of 20 days. He added that there are 30 states and union territories in the country which have reported a decline in the number of cases since last week. Mr. Love Agrawal has said the recovery rate is continuously improving in the country. He said the recovery rate was over 81% in the country on the 3rd of May and now it has reached 92%. He said 32 states and union territories have witnessed more recoveries in comparison to fresh cases today. He said the positivity rate is continuously declining in the country.
जहां 3 मई के समय में देश में टोटल रिकवरीज वर अराउंड 81.7%, वह बढ़ते बढ़ते अब 92% हो गई है। 55 दिनों में हमने देखा है कि एक बहुत ही पॉजिटिव ट्रेंड देश में नोट किया गया है और 32 स्टेट ऐसी हैं जहां पर रिकवरीज आर मोर देन द डेली केसेस रिपोर्टेड ऑन ए डेली बेसिस, जो कि एक बहुत ही पॉजिटिव ट्रेंड है।
Mr. Agrawal said the country has ramped up COVID-19 testing for the early detection of the cases. He said various laboratories are doing on an average 20 lakh tests in the country these days, which is 2.7 times more in comparison to tests that were done in February this year. He said more than 34 crore tests have been done in the country so far.
ऑन एन एवरेज 7.7 लाख टेस्ट डेली किए जा रहे थे, वह 2.7 टाइम्स बढ़ते हुए अब करीब 20 लाख प्लस टेस्ट हम डेली बेसिस पर देश में कर रहे हैं। जहां एक स्थाई पर हम टेस्ट बढ़ा रहे हैं, वहां पिछले 2 हफ्तों से ऑन एन एवरेज देश में 20 लाख से अधिक टेस्ट किए जा रहे हैं और हम लोग अब तक देश में टोटल 34.67 करोड़ टेस्ट कर चुके हैं। पिछले 24 घंटों में भी देश में अराउंड 19.25 लाख टेस्ट किए गए हैं।
Mr. Agrawal further said the country is witnessing a declining trend in case positivity for the last 3 weeks. He said 8.31% of the case positivity was recorded in the country last week and daily positivity rate has been recorded below 10% from the last 7 days. He said there are 344 districts in the country which are registering less than 5% of case positivity.
जो हमने स्टेट्स को एडवाइस दी है कि हमें एफर्ट ये करने की हमारी पॉजिटिव 5% से कम रहे, तो उसको भी अगर हम ट्रेंड को एनालाइज करते हैं तो वीक एंडिंग 7th मई से वीक एंडिंग 31st मई को जहां देश में 92 ऐसे डिस्ट्रिक्ट थे जिसमें की पॉजिटिविटी 5% से कम थी, वह बढ़ते बढ़ते अब 344 जिले हो गए हैं। यानी कि 252 जिले उसमें ऐसे ऐड हुए हैं जहां पर की केस पॉजिटिविटी 5% से भी अब कम नोट की जा रही है।
Terming the vaccination a major tool in the fight against the COVID-19 pandemic, Mr. Agrawal has said over 21 crore 60 lakh COVID vaccine doses have been administered to the beneficiaries so far across the country. He said the union government is continuously engaged in providing vaccines to the states and union territories. He said more than 4 crore vaccine doses have been provided to states and union territories free of cost in the last month by the union government. Mr. Agrawal also said, despite the decrease in the fresh cases and positivity rate, people must rigorously follow the COVID-19 appropriate behavior.
Director General of Indian Council of Medical Research, Professor Balram Bhargav, has said that lockdown must be lifted in a gradual manner, wherein the positivity rate has come down. Briefing the media in New Delhi today, he said the country is moving in the right direction as the containment measures have worked well to bring down the number of COVID cases in the country.
We have to find a mechanism how we have to ease our containment or lockdown, and that has to be done very gradually and very slowly. So it basically revolves, the opening up revolves on 3 pillars. 1, the test positivity rate in that particular district has to be less than 5% over 1 week. So 7-day average has to be less than 5%. The second point is the vulnerable individuals, that is elderly, more than 60, more than 45 with comorbidities should be vaccinated tremendously, and their vaccination rate should reach up to 70%. And the third point is that community ownership for this whole program of COVID-appropriate behavior as well as care should be taken up by the community in a big way.
Professor Bhargav expressed hope that the entire population of the country will be vaccinated by the end of December this year. He said India is one of the 5 countries in the world which is producing indigenous vaccine. He said there is no shortage of vaccine in the country. Member Health Niti Aayog Dr. V.K. Paul has warned that the outbreak of COVID disease can increase in children if the coronavirus changes its form. He said the childhood COVID disease is gaining attention in the country and the COVID-19 infection has not taken a serious shape among the children. Briefing the media in New Delhi today, Mr. Paul said COVID-19 in children is often asymptomatic and rarely requires hospitalization. However, it is possible that 2 to 3% of children who get infected may need hospitalization. He assured that all the arrangements and steps will be taken to contain the spread of COVID-19 among children. Mr. Paul has informed that a national expert group has been formed to review COVID-19 infections in children and approach the pandemic in a renewed way to strengthen the nation's preparedness. He said fresh guidelines will be adopted based on review of the data by the expert group. Refuting a claim that only 1 dose of Covishield vaccine is enough, he clarified that 2 doses must be administered for better results. The Defence Research and Development Organization today issued directions for use of 2DG medicine. It said the drug can be given to COVID-19 patients under the care and prescription of doctors as per DCGI approval. The 2DG drug is approved for emergency use as adjunct therapy to the standard of care in the treatment of COVID patients in hospital settings. Caution should be exercised in patients with uncontrolled diabetes, severe cardiac problem, severe hepatic and renal impairment, as the effect of this drug on these patients has not been studied yet. It should not be given to pregnant and lactating women and patients below 18 years. Patients and attendants are advised to request their hospitals to contact Dr. Reddy's Lab, Hyderabad, for medicine supply at the email address 2dg@drreddys.com.
The centre has scaled up the production of antifungal drug amphotericin B to nearly 260% in less than a month to build a stabilized demand-supply balance in the country. Union Chemicals and Fertilizers Minister D.V. Sadanand Gowda informed that the government is continuously reviewing the availability of COVID-19 treatment drugs with existing and new manufacturers to meet all the demands. He said production, supply and stock position of vital drugs used in the treatment of COVID such as dexamethasone, methylprednisolone, enoxaparin, favipiravir and ivermectin are being reviewed weekly. The minister added that their production has also been augmented and stocks available in the country are able to meet the current demands. Mr. Gowda said that over 270,000 vials of amphotericin B used in the treatment of mucormycosis have been allocated to the states, UTs and other central institutions in the last nearly 20 days. He said this was in addition to the supplies of over 81,000 vials that were done by the manufacturers to the states in the first week of May. The minister further informed that 20,000 vials of 80 mg and 1,000 vials of 200 mg of tocilizumab are likely to arrive in the country this month. He said nearly 99 lakh vials of antiviral drug remdesivir were also allocated to states, UTs and central institutions in the last around 40 days. Mr. Gowda added that the ministry has formulated plans to supply up to 91 lakh vials of remdesivir in the country in the current month. Production of the antiviral drug has been ramped up nearly 10 times in the last 1 month and its supplies now exceeds the demands. You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. CBSE 12th board examinations cancelled. Prime Minister Narendra Modi says the decision on exams has been taken in the interest of students. India registers significant decline in active caseload and number of fresh cases. Recovery rate improves to 92.09%. More than 21 crore 60 lakh vaccine doses administered in the country so far. Defence Research and Development Organization issues directions for the use of 2DG medicine. Centre introduces new system for processing of insurance claims under Pradhan Mantri Garib Kalyan Package Insurance Scheme for health workers fighting COVID-19. External Affairs Minister Dr. S. Jaishankar says collective endeavour of BRICS is to ensure that global decision-making reflects contemporary realities. Mahesh Jethmalani and Swapan Dasgupta nominated to Rajya Sabha. And in tennis, world number 1 Ashley Barty cruises into the next round of French Open. Naomi Osaka pulls out of tournament amid row over media briefing. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back. You're listening to the evening news. The Union Government has issued operational guidelines for Production-Linked Incentive Scheme of Pharmaceuticals. Department of Pharmaceuticals has notified the Production-Linked Incentive PLI scheme for pharmaceuticals in March this year with a view to enhance India's manufacturing capabilities by increasing investment and production in the sector. The approved outlay of the scheme is 15,000 crore rupees. The scheme envisages to create global champions out of India who have the potential to grow in size and scale using cutting-edge technology and thereby penetrate the global value chains. The Ministry of Chemicals and Fertilizers in a statement said that the operational guidelines for the scheme was prepared based on a series of consultations with pharmaceutical industry and stakeholders in the government. The scheme is now open to applications from the industry and are invited in 3 groups based on the global manufacturing revenue of financial year 2019-20 of the applicants. All the applications will be submitted through an online portal maintained by SIDBI, the project management agency for the scheme. The application window is for 60 days starting from 2nd of June to 31st of July. Union Health Minister Dr. Harshvardhan has urged the Rajasthan government to probe the report of alleged high wastage of COVID vaccine in the state. In a letter to State Health Minister Raghu Sharma, Dr. Harshvardhan, while referring to a media report, said the high COVID-19 vaccine wastage in certain districts of Rajasthan is a matter of grave concern and asked him to urgently investigate the matter and firm up the planning of the vaccination drive. A media report has highlighted that more than 500 vials of COVID-19 vaccines were found dumped in the waste bins of 35 COVID vaccination centers in the state. The Union Minister said in almost all districts, vaccine wastage is more than the national average, which is less than 1%. Railways has delivered more than 22,916 tons of liquid medical oxygen to 15 states across the country. The Railways Ministry said Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states, and so far 334 oxygen expresses have completed their journey. The ministry said oxygen relief by oxygen expresses reached out to 15 states, namely Uttarakhand, Karnataka, Maharashtra, Madhya Pradesh, Andhra Pradesh, Rajasthan, Tamil Nadu, Haryana, Telangana, Punjab, Kerala, Delhi, Uttar Pradesh, Jharkhand and Assam. Railways is picking up oxygen from places like Hapa, Baroda, Mundra in the west and Rourkela, Durgapur, Tatanagar, Angul in the east and then delivering it to various states. The ministry said southern states of Andhra Pradesh, Tamil Nadu, Karnataka and Telangana have received more than 2,000 tons of liquid medical oxygen each from oxygen expresses.
The centre has introduced a new system for processing of the insurance claims provided under Pradhan Mantri Garib Kalyan Package PMJKP insurance scheme for the health workers fighting COVID-19. The Union Ministry of Health in a statement said that states and other stakeholders had been raising the matter that the processing of the insurance claims was getting delayed. It said, with a view to streamline and simplify the processing of the insurance claims, it has been decided to start a new system for approval of claims. As per the system, the due diligence will be done by the state governments at the level of the district collector. The district collector in each case will certify that the claim is in accordance with the standing operating procedure of the scheme. On the basis of this certificate, insurance company will approve and settle the claims within a period of 48 hours. Further, for the sake of uniformity and prompt disposal, the district collector will also do due diligence and certify the claims even in case of the central government hospitals, AIIMS and the railways. The Health Ministry has informed all state governments and UT administrations about this new system, which comes into effect immediately. More from our correspondent.
प्रधानमंत्री गरीब कल्याण पैकेज इंश्योरेंस स्कीम for health workers fighting COVID-19 had been launched in March last year to provide comprehensive personal accident cover of 50 lakh rupees. The government has already extended the insurance scheme for these workers for 1 year with effect from 24th April this year. The scheme is being implemented through an insurance policy from New India Assurance Company. Safety of the frontline healthcare providers remains the top priority of the central government, and therefore it revived this insurance policy for a period of 1 year so as to provide the safety net to the dependents of the health workers. Anand Kumar, AIR News, Delhi.
External Affairs Minister Dr. S. Jaishankar today said that BRICS has evolved its own unique model of engagement that is based on consensus over the years. In his opening remarks at the meeting of BRICS foreign ministers, Dr. Jaishankar said the collective endeavor of BRICS is to ensure that global decision-making reflects contemporary realities. The minister said BRICS has come a long way from the first time the foreign ministers met in New York in 2006.
But the principles that guide our grouping remain consistent over the years. We strive for a fair, just, inclusive, equitable and representative multipolar international system. It is one based on international law and the UN Charter that recognizes the sovereign equality of all states and respects their territorial integrity while displaying mutual respect for interests and concerns of all. It is only by conducting our policies in accordance with these principles that we can expect to bring about the change we desire.
Dr. S. Jaishankar said BRICS strives for a fair, just, inclusive, equitable and representative multipolar international system. It is one based on international law and the UN Charter that recognizes the sovereign equality of all states and respects their territorial integrity while displaying mutual respect for interests and concerns of all. Dr. Jaishankar stressed that only by conducting policies in accordance with these principles, the desired change can be brought about. India is the BRICS chair for 2021. 4 key deliverables were identified for India's chairmanship. These are reforms of the multilateral system, counter-terrorism cooperation, using digital and technological solutions to achieve sustainable development goals, and enhancing people-to-people cooperation. Dr. S. Jaishankar expressed happiness that substantial progress has been made on each of these areas in the past 5 months. During the meeting, the ministers reviewed progress in intra-BRICS cooperation and collaboration. They exchanged views on major international and regional issues in the political, security, economic, trade, financial and sustainable development spheres. The minister expressed grave concern over the continuing public health, societal and economic impact of the COVID-19 pandemic globally.
Senior advocate Mahesh Jethmalani has been nominated to the Rajya Sabha. He is the son of renowned lawyer Ram Jethmalani, who was also a Rajya Sabha member. Besides Mahesh Jethmalani, President Ramnath Kovind nominated Swapan Das Gupta. Mr. Das Gupta had resigned from the upper house in March this year after the BJP fielded him as a candidate in the West Bengal Assembly elections. He has been renominated to the Rajya Sabha. The nominated members are drawn from fields such as arts, literature, science, sports and social service. The ongoing COVID pandemic has been a challenging time, especially for the doctors, nurses and the paramedical staff. The dedication and selfless service of all the medical personnel has helped the country to deal with the unprecedented crisis. Talking to AIR News, Dr. Anchan Trikha, Professor Critical Care of COVID Center, shares the story of a nurse who selflessly took care of COVID patients along with a mother. More in this report.
Relatives of the COVID patients are not allowed in the COVID care wards in AIIMS to keep them safe from the infection. One of the professional nurse working in the peripheral hospital of the AIIMS took 3 weeks leave from the hospital where she is working in the NCR so that she could take care of her ill mother. The nurse was officially deputed in the COVID ward of AIIMS for 3 weeks where her mother was admitted. Dr. Trikha informs, in those 3 weeks the nurse worked extra hours in the PPE suit and took care of 5 COVID patients, easily easing the burden of the medical staff.
This lady assured me that she'll take leave for 3 weeks. She will be posted. She will come here on her own. Instead of inside being for 6 hours, she volunteered to be there for 10 hours. She'll come at 9, go off after about, giving her mother some late evening food also. And meanwhile, as long as she's inside, she would take care of other patients. And we gave her the responsibility of 4 more patients.
Pandemic has brought to the fore human values and will always be remembered as how the society came forward collectively to fight the invisible enemy. Diksha Saxena, AIR News, Delhi.
The centre has allocated around 7,000 crore rupees grant to West Bengal under the Jal Jeevan Mission for 2021-22 to provide every household with assured tap water supply on a regular and long-term basis. At the time of announcement of Jal Jeevan Mission, out of 163.25 lakh rural households in West Bengal, tap water supply to whom was limited to only 2.14 lakh households, which is about 1%.
In tennis, Ashley Barty has cruised into the next round of French Open. She defeated Bernarda Pera 6-4, 3-6, 6-2. Rafael Nadal's bid for the 21st Grand Slam title begins today. The match against Australia's Alexei Popyrin in round 1 of the French Open 2021. If Nadal manages to win the title, it will be his 21st overall Grand Slam title, which will be the highest achieved by any men's player ever. He will play his first match against Alexei Popyrin of Australia, while Djokovic will face Sangren of USA. Roger Federer, Rafael Nadal and Novak Djokovic are all in the same quarter, which means only one of them could go in the finals. It is being speculated that Djokovic might face Nadal in the semi-finals, but it won't be easy for the Spaniard to win his 14th Roland Garros this time. Earlier, Naomi Osaka withdrew herself from the French Open following the bitter fallout from her decision to boycott all media activity at the Grand Slam event. The 4-time Grand Slam winner and world number 2 tennis player was fined $15,000 yesterday. She was threatened with disqualification after she refused to carry out a mandatory news conference following her first round win. A claim is being made in a WhatsApp message that Government of India is providing free internet services to 100 million users for 3 months. Press Information Bureau has said that this claim is fake. It said that the centre has not made any such announcement.
And now let's take a look at the weather forecast for tomorrow. National capital Delhi will have a generally cloudy sky with light rain. The minimum temperature will be 19 degrees and maximum will go up to 36 degrees Celsius. Mumbai will have a partly cloudy sky with 1 or 2 spells of rain or thunder showers. Chennai will see a partly cloudy sky as well. Temperature will vary between 29 and 39 degrees Celsius. Kolkata will see a partly cloudy sky with possibility of moderate rain or thunderstorm. Minimum temperature was 27 degrees Celsius and maximum will go up to 35 degrees. Jammu will have a mainly clear sky becoming partly cloudy towards the afternoon or evening. Minimum temperature was 23 degrees Celsius while maximum will be around 37 degrees Celsius. Srinagar will have a partly cloudy sky with possibility of rain or thunderstorm or dust storm. Temperature will hover between 13 and 28 degrees Celsius. Leh will have a generally cloudy sky with light rain. Gilgit will see a generally cloudy sky with light rain. Muzaffarabad will have a partly cloudy sky with rain or thunderstorm or dust storm. Minimum temperature will be 18 and maximum will be around 32 degrees Celsius. And now, before we end the bulletin, the headlines once again. CBSE 12th board examinations cancelled. Prime Minister Narendra Modi says the decision on exams has been taken in the interest of students. India registers significant decline in active caseload and number of fresh cases. Recovery rate improves to 92.09%. More than 21 crore 60 lakh vaccine doses administered in the country so far. DRDO issues directions for use of 2DG medicine. Centre introduces new system for processing of insurance claims under Pradhan Mantri Garib Kalyan Package Insurance Scheme for health workers fighting COVID-19. External Affairs Minister Dr. S. Jaishankar says collective endeavour of BRICS is to ensure that global decision-making reflects contemporary realities. Mahesh Jethmalani and Sapan Das Gupta nominated to Rajya Sabha. And in tennis, world number 1 Ashley Barty cruises into next round of French Open. Naomi Osaka pulls out of tournament amid row over media briefing. And with that, we end the evening news. Good night.